So let's talk you through what the program really entails. What we know is that these hormones work together in a very complex way at various parts of the body. Some work on your brain in what's called your satiety or satisfaction centers to either make you feel less hungry or more hungry. They also affect the way that your stomach empties out, so it slows it down to make you feel more full. And some of them also change your metabolism. Of all the different hormones that we've studied and that are known to us, the one that we've effectively been able to capture is called GLP-1. GLP-1 has been made into medical therapy that can be given both as injections and as tablets. What GLP-1 normally does is that if everything's working normally, when you eat food, the food travels down from your mouth, through your food pipe, into your stomach and down to your intestines. The intestines or your gut then makes this hormone called GLP-1. What the GLP-1 then does is it has a number of different actions. The first thing that it does is that it goes to the pancreas to communicate with the pancreas to say, food's arrived, make the right amount of insulin to deal with the carbohydrates or the sugar that's arrived in the meal that you've just eaten. GLP-1 is an effective treatment for type 2 diabetes, and this is one of the key mechanisms by which it works in patients with type 2 diabetes. What it does is it reestablishes the connection between the gut and the pancreas. In patients who are obese and overweight, when there is a disconnect because you're not making enough of the hormone GLP-1, your pancreas doesn't get the message that food's arrived. So the pancreas doesn't make the right amount of insulin, and therefore you don't bring your blood sugar levels into control. That then eventually develops into type 2 diabetes. So when you are treating patients with type 2 diabetes with GLP-1, this is a key mechanism of getting their diabetes, their blood glucose levels under control by re-establishing the contact between the gut and the pancreas. The second thing that the GLP-1 molecule does is that it travels in a way to your liver. Now your liver has got glucose or sugar stored in it in the form of a molecule called glycogen. And what happens is that when you have type 2 diabetes, you always end up with some of this stored glucose coming out into the circulation and adding to the high glucose levels within your circulation. What the hormone does when you have enough of it is stop that glucose from coming out into the circulation. And this is again another mechanism by which we're able to help people with type 2 diabetes treat their diabetes and bring their blood glucose levels under control. But when we talk about weight loss in people who don't have diabetes, the key thing that GLP-1 does is that it helps them at two levels. So one at the level of their stomach, and two at the level of their brain where the satisfaction or satiety center is. So GLP-1 allows you and helps you to feel more full and more satisfied on less volumes of food. And it does that, one, physically by slowing down your stomach, and this is part of the effect. But one of the key things that it does is it travels up through your circulation, up to your brain, to those areas and says, do you know what? You've had enough now. You can stop. And what that does for a lot of people who are looking to lose weight and get healthier is it allows them to control the cravings that they've always had. Allow them to control the hunger, the portion sizes. Because a lot of people that I look after have struggled over the years because they feel like they're eating healthy food. And there's nothing wrong with trying to eat a healthy, balanced diet. The problem is that a lot of people who are struggling with their weight are just eating more. That's too much of a portion size for their metabolism and for their body, for them to allow them to lose weight. So when we treat people who are overweight with GLP-1 agonist injections, so that's the medical version of the hormone which is naturally occurring inside the body, what we're doing is giving them their control back. So when I talk to patients, I say to them that this is a journey about understanding what your levels of appetite are. It's about understanding where you say enough is enough. Some of the benefits that my patients talk about beyond losing weight and seeing the numbers on their scales get lower and lower is the sense of control they feel. It's the sense of relief they feel that they're not constantly thinking about where do I get my next snack? How do I function because I'm slowing down without something to eat or drink? And that is the greater benefit that a lot of my patients get. So how do we administer GLP-1 agonists? So like I said to you, there are injections and there are tablets. Most of my patients find that injections are the more effective treatment. If you're absolutely against having an injection, the tablets are working, but not as effectively based on the feedback that we get. The injections are given just once a week. These hormone injections of GLP-1 have been around for a long time, and we used to have and still have a daily version of the injection, but most people have moved on to having the weekly version of the injection because it's more convenient and because it's just more effective. And that is what our patients use. The injection's administered once a week, and it's used with a pen, which I will demonstrate to you in a separate video. And you inject it in and around your tummy, just below and to the sides of your belly button. You can inject to other parts of your body wherever there's a little bit of what we call subcutaneous fat. So that's a bit of fat below your skin. What we do in the program is that we start you on a low dose of the injection. Usually it's a 1/4 milligram, and that's a weekly dose of a 1/4 milligram of the medication called semaglutide. That's done on a weekly basis, and we gradually build up the dose. So every 4 weeks we contact you and we bring you in and we sit down and we review your progress, side effects, and we try and increase the dose based on your tolerability, based on your progress. The normal escalation dosing is from a 1/4 milligram for 4 weeks to 1/2 milligram for 4 weeks, and then to 1 milligram for the next 4 weeks. We try and get people to embark on that 3-month journey to start, and we call it the kickstart because that's what you need. What I say to people is, when it comes to losing weight on our program, it's not a quick fix. It's not a miracle. What the medication allows you to do is start your journey and sustain your journey for as long as that may take, with the support of not feeling that hunger, that craving, and allow you to live on less calories and less volume of food so that in time you can lose weight. People always want to know what the benefit is and how quickly they'll see that benefit. And I say to them that in the first 4 weeks, the average weight loss in my patients over the years that I've treated people is between 6 and 8 pounds. The average weight loss at the 3 months when we get up to the 1 milligram dose is usually about 1.5 stone, but that's an average. I have people who've lost lots more and some people who've lost a little less, but usually not a lot less than that. And the benefit depends very much on what your starting point is. So the heavier you are, the more weight you're likely to lose. The heavier you are, the more quickly you're likely to lose that weight. But every individual is different. And that's why it's important for you to recognize that there is no fixed formula for this. But the one thing I say to people is that if you suit the medication and don't have side effects and can tolerate it, and if you feel that appetite control benefit and know that you are actually living, functioning, and continuing on a lot less calorie and volume of food intake than you were before you started the program, your weight loss is inevitable. People also ask me, well, what happens at the end of 3 months? And I say to them, well, at the end of 3 months, you may or may not have reached the goal that you were hoping to achieve. Now, if you're heavier, you may need longer to get to the goal that you're looking for. But at that 3-month point, what we do is reevaluate where you are. And if there is a further distance to go, Then we can either continue on the same dose if you're still feeling the weight loss benefit through appetite control, and you can gauge that. Or if you feel like the 1 milligram dose isn't strong enough, then there are higher doses that we can go to. And that is something that we would discuss with you with every review, with every contact, so that we make sure that you never stagnate, you never plateau, and that you keep moving and you keep moving until you get to the target weight that you want to achieve. So the other detail that people want to know is what happens when I get to my target weight. And I say to people that there are two kinds of patients that I look after. There's ones who achieve their target weight and have made such a change in their life where they're eating healthier, they're almost programmed to eat smaller portions already, they're back at the gym and they're exercising. And what they do is they gradually reduce the dose of the medication. So we build up the dose, get you to your target, and then we reduce the dose and see if we can get you off the medication. And if you're able to get off the medication and maintain your weight, that's fantastic. But we know that there are people who need a more sustained course of treatment. And so some people, when they get to their target weight, I try and reduce the dose and I get them to the lowest dose that will help them to maintain their weight. In some people, when they stop the medication, they do regain a little bit of weight, occasionally about 5%, maybe 10%, but they never go back to where they started their weight loss journey. And that's the amazing thing. The other thing that people need to be aware of is that whenever you take a medication, you've got to be prepared that for some people, there may be some side effects. But being prepared, counseled about those side effects is the most important part of this, because the side effects that usually come with these medications, with semaglutide, are often very mild and transient. The one thing I say to people is that the first thing you'll probably notice potentially is a bit of nausea. And it's usually because your stomach slows down. And if you remember, I said to you that one of the ways in which the hormone works is it makes you feel full by slowing your stomach down and making you feel full. So the simple starting rule that I tell my patients is, when you start the medication and you start the program, you've got to make a conscious effort to get rid of your regular plate, and you must only try and eat what you can off a small plate. If you try and eat what you would normally eat when you've started the medication, you may well be sick. And it's important that if you follow the rules, you will probably just sail through without even experiencing the nausea. Now, some people get a bit of diarrhea, and it tends to be mild, it lasts a few days and it disappears. Some people go the other way, and they end up with constipation. Now, if you get constipated, you may occasionally need to take something with a bit of fiber in it to try and keep things moving. But as you move up on the dose of the medication and you're established on the higher doses, the bowels tend to settle down again. The other theoretical risks that I talk to my patients about is that of a condition called pancreatitis. Because the hormone works by stimulating the insulin production from your pancreas, we talk about pancreatitis, but actually in the trials and in general day-to-day practice, we don't really see a lot of this. But one of the scenarios that's important to consider, and I see a bit more, is when you gain weight, you have a risk of developing gallstones. The same way, when you lose weight, you have a risk of developing gallstones. Sometimes these gallstones can cause a bit of pain, sometimes they can slip out and cause problems with the collecting tubes around the pancreas and the gallbladder, and sometimes that can cause inflammation. But these are very rare side effects. In practical terms, the next steps for you, if you wanted to join the program, would be to book a consultation with one of our clinicians, and we would take you through all of these. I would also ask you to look up the medications online. So semaglutide is known by different names. It's known by Ozempic. It's known by Wegovy, W-E-G-O-V-Y. And if you look them up, there's lots of information out there and lots of additional information on our website. And also I would recommend that you understand from the website. So there's something called the Medicines Information website, or the SMPC. So if you type in the medication, you'll get a breakdown of benefits, side effects, doses, everything. And I prefer my patients to come prepared, because this is not a journey where, in the good old days, your doctor said, take this and it will work and you do what I tell you to do. That's not how this needs to work. What I want is for my patients to be engaged, be partners in this journey, because this is your journey. This is your walk. I'm here, our team is here to walk that journey with you. So people also ask me, what about diet? What should I do about my diet? And I say to people, the purpose of the program is not to give you like a fad diet, right? So some people come to me and say they've done Weight Watchers, they've done Slimming World, they've done Michael Mosley, they've done intermittent fasting, they've done the 5-2 diet. I mean, any diet is a good diet if you can achieve the goals you're looking for and you can sustain the diet. The problem we find is that a lot of diets are difficult to sustain, and that's why people rebound and yo-yo from diet to diet. What the medical therapy, along with the change in habits, allows you to do is make that more sustainable. In terms of dietary advice, we talk about a number of different concepts, and you can get into as much detail of this as you need to help you. So we talk about calorie reduction, and that's the first thing. Now, calorie reduction can obviously be reduced by reducing the volume of food that you consume, and that's what the program allows you to do. But even beyond that, choosing the right foods to bring your calorie content down is another way to make that weight loss journey more effective and productive. So we talk about calorie density. So certain foods have got higher calories for the volume that you consume than others do. So you might want to think about foods that are less rich in carbohydrates and more rich in protein, because protein obviously has less energy burn and less calorie than carbohydrates do. So when I say carbohydrates, I'm talking about starch. So we're talking about wheat, rice, potatoes, that kind of stuff. The other thing we talk about when it comes to diet is the program's designed for you to eat the things that you normally eat from a healthy, balanced diet. But the key is to eat less of everything and be able to feel better by eating less, which is what the hormone injection allows you to do. The other concept that we use is that of low glycemic index foods. And low glycemic index is an interesting concept. So there are certain foods that get broken down very quickly in your system, and therefore the blood sugar levels go up very quickly and overshoot the normal range. So when you go above that normal range, you kind of end up with a little too much sugar that you can't use, and that then gets stored. So if you have low glycemic index foods, then what you find is that your sugar levels are level, and therefore you don't store as much. You actually feel less hungry over time because your sugar levels aren't dropping, and you're able to sustain and help yourself lose weight. The other feedback that we get is that people tell us that because their appetite's so well controlled, they sometimes skip breakfast or feel like they want to skip lunch. But we don't encourage that, because if you miss a meal, it is likely that your blood sugar levels will start to drop towards the bottom end of the normal range. What that does is actually drives you to be hungry and snack and reach for things that have got a lot of sugar, because that's what your body's trying to make you do. What you want to do is avoid that by having a little something of what we call a low glycemic index snack that will allow you to keep your sugar levels steady and not have to pick and not have to feel that hunger, and therefore manage to sustain that appetite control over a longer period of time. The other thing we encourage people to do is, because your volume of intake goes down, is to drink enough water, enough fluid. We often say 2 to 3 liters is what you need really to keep things moving and keep yourself hydrated. A lot of times thirst is experienced as hunger, and people go and eat instead of actually drinking something. The other thing we encourage you to do is think about your routine. Do you sit down and watch TV while you eat? And is that just become a habit? Also, do you take time to sit down and take a few bites of something that tastes nice and enjoy the taste? and then say, actually, I've enjoyed that now, and I don't need more to make me enjoy that meal any further. These are all little tricks that we try and support you with to try and help you be mindful about how you can manage your behaviors around eating, and these go a long way to sustaining your weight loss, initially on the medication, and then potentially once you come off the medication as well in the future. So because the weekly pen is a weekly pen, it doesn't really matter what time of day you take it. It doesn't matter whether it's taken with food or, at a different time of the day. But all we encourage you to do is take it at the same or similar time every week. So the way that the medication works is that it builds up slowly as we start on a low dose and build you up. And therefore, you only need to take the medication once a week at any given time and stick to that time. So, I'm hoping that all that information I've given you has not overloaded you, but it's given you an indication, an understanding of what's really involved. Because this isn't about a one-off connection between yourselves and our team. This is about a journey that we need to walk together for potentially months to come. But what we do guarantee you is that if it all works to plan, you will achieve those goals that you've always dreamt of achieving, and you will get to a healthier, happier you.